Hi everyone, Dr. Campbell here, and I want to focus on the fifth character of the ICD-10 PCS code, specifically in the medical and surgical section. The fifth character, which is the approach, is the technique that is used to reach the site of the procedure. In ICD-10 PCS, there are a total of 7 different approaches. First, which is represented by character value 0, is open. Open is cutting through the skin or mucous membrane and any other body layers that are necessary to expose the site of the procedure. This means that the physician can actually see the site that they're working on with their naked eye. Next, represented by character value 3, percutaneous. Entry by puncture or minor incision of instrumentation through the skin or mucous membrane and any other body layers that are necessary to reach the site of the procedure. Let's pause. Difference between open and percutaneous. Open, the site is exposed. Percutaneous, the provider is reaching the site. Next, represented by a character value of 4, percutaneous endoscopic. Percutaneous endoscopic is entry by puncture or minor incision of instrumentation through the skin or mucous membrane and any other body layers that are necessary, watch this guys, to reach and visualize the procedure. So the difference between percutaneous and percutaneous endoscopic. Percutaneous, we're reaching the site of the procedure. Percutaneous endoscopic, we're able to reach and visualize the site of the procedure. Next is character value number 7, which is via natural or artificial opening. This is entry of instrumentation through a natural or artificial external opening to reach the site of the procedure. What you want to note here with character value number 7, there is no endoscope involved and the provider is reaching the site of the procedure. Next, character value 8, via natural or artificial opening endoscopic. Here, entry of instrumentation through a natural or artificial opening, and the provider is able to reach and visualize the site of the procedure. They're able to visualize the site using an endoscope. And there are a variety of endoscopes, all right? Arthroscope, hysteroscope, laparoscope, sinoscope, thoracoscope, guys. Lots of options. Research the different types of endoscopes. Of note, a fluoroscope is a type of imaging tool. Last 2 approaches, via natural or artificial opening with percutaneous endoscopic assistance. Here, entry of instruments through a natural or artificial opening and, notice the and, entry by puncture or minor incision of the instrumentation through the skin or mucous membrane and any other body layers necessary to aid in the performance of the procedure. This particular character has limited use, all right, and you'll know it when you start to code this particular procedure. Lastly, external. Procedures performed directly on the skin or mucous membrane and procedures performed indirectly by the application of external force through the skin or mucous membrane. All right, those are your 7 approaches, guys. Learn those approaches. They are just as important as your root operations. Now, before we go, the approach actually comprises 3 components. First, the access location. Second, which is the method. And third, which is the type of instrumentation. As it relates to the access location, there are two general types of access locations, either skin or mucous membrane or external orifice. As it relates to skin or mucous membrane, this is where the skin or mucous membrane is cut or punctured, could be with a needle, to reach the procedure site. Here, your procedure can be performed directly on the skin or mucous membrane. External orifice, guys, is where the site of the procedure can be reached through an external opening. An external opening, guys, could be the mouth, that's a natural opening, or it can be artificial, such as with a colostomy stoma. It's on the outside of the body. Second, guys, we're talking about the method. The method is how the access location is entered. As you know, with open, the provider is cutting through the skin or mucous membrane and any other layers that are needed to expose the site of the procedure. The instrumentation method, guys, is the entry of the instrument through the access location all the way through to the internal procedure site. Instrumentation can be introduced by a puncture or a minor incision. Or, guys, they can go through an external opening. Speaking of the types of instrumentation, couple of examples. First, an endoscope is where the physician is able to reach and visualize the site. Instrumentation can be a needle, such as in a needle biopsy. Lastly, procedures can be performed indirectly by the application of external force, such as when the patient has a closed reduction of a fracture. All right, guys, this is Dr. Campbell signing off. Approach to ICD-10 PCS. Learn the approaches, and as always, thank you so much for listening, and please subscribe to my channel.